First and foremost, I tell patients, listen, there's no such thing as a diet, it's a lifestyle. The reason there's a million diets is none of them work. You're right in my wheelhouse, man. I
Yeah,
probably talk more nutrition to patients than their primary care
that's
docs do.
great. Love to hear that.
And I look at it as first, I need to model good behavior. I was not always a healthy eater, and I feel as a healthcare provider, we need to be good models for our patients. So I absolutely discuss it. Certainly specific to urology, there's some data discussing prostate friendly diets, but I probably spend more time just talking about their overall health. Because for better or for worse, a lot of the conditions I treat, you're not going to die of. I know you're
Mhm.
worried about your erectile dysfunction, but
Indicative of,
it's indicative of atherosclerosis.
yeah.
And what's atherosclerosis? Well, it's because of the diabetes, the high blood pressure, the obesity. So no, I'm a huge proponent of that. I talk about some of the same, you know, principles of eating. I think first and foremost, I tell patients, listen, there's no such thing as a diet, it's a lifestyle. The reason there's a million diets is none of them work. And that when you just do that subtle sort of Jedi mind trick and just say, no, I'm not on a diet, this is just how I eat now. That's a very powerful thing that worked for me and I think has worked for patients. I think there's a lot of interesting data out there now about time restricted eating. That's something that to me is very, very powerful, but yet simple, because it's hard to go through a list with patients of, well, what can I eat? What can't I eat? Well, that sounds restrictive. But if you just simply say, all right, let's just consume all your calories in a 6 to 8 hour window, pretty much everybody gets that concept. And they go, oh, I can do that. And then you sort of start incorporating some of the higher level things that can supercharge that time restricted eating:
Mhm.
high protein, high vegetable, low carbohydrate, especially processed carbs. And now all of a sudden you're making impacts. And we take for granted that everybody shares the same knowledge base about nutrition. What's obvious to the three of us is not obvious to a lot of our patients. I mean, I had a patient who, when I said, you should really make sure your family is only drinking skim milk, she said, well, what's that? What color is that? I mean, didn't know that there was a difference in whole milk and skim milk.
Mhm.
I had a guy who lost 20 pounds recently because I just told him to stop drinking Mountain Dew. I mean,
That'll
20
do
pound
it,
weight,
yeah.
20 pound weight loss in 2 weeks. And so, and I'm not sitting there counseling people for 45 minutes. I mean, I think if you
Right.
just care and you talk about it and you step back, and rather than just, push them the Viagra and say, see you later, you spend just a few minutes on it and then provide some good resources. We have to do that in medicine and in all aspects of healthcare. Because if we're not addressing the diet, everything else we're doing is a Band-Aid.
Falls
So
apart. Yeah.
it really does. It doesn't matter how great of a pharmacist you are, how great of a medicine you're handing a patient. If they are non-compliant with their lifestyle, they're not going to get better. And that definitely rolls over into urology, from bladder health, prostate health, and sexual health.